I went to my GP, Hugh Palmer, I've known for many, many, many years, and I'd had problems with the knees, and I said to Hugh, my hip is playing up, and it's worse than both knees put together. It's terrible, terrible. I mean, I'm getting old, but there you go. So he said, we send you over to Greensborough. I went to Greensborough. A lady got one of those CAT skip, what they call, little ultrasound. And she's looking puzzled, and she's going round like this. She's going up and to here. And what's this? She goes, this side, nothing wrong with this side. Go to your GP. And that's how I found out I had it. She picked it up that day. And of course, I said, Hugh's away on holiday, and she said, look, go to any GP. And sent me to Jason, Mr. Chewin, and he sort of took it on from there.
Okay, so for those of you who don't know what we do at the lab, we do a lot of 3D printed anatomical modelling. And what I don't know if you're aware as well, Roger, you were actually the first patient we ever 3D printed.
Yes, I was.
So Roger had a little bit of quite a difficult AAA in terms of pre-surgical planning. It was very torturous, it was quite large, and we actually 3D printed it and took it to our team meeting to decide how we were going to approach this, and we then decided open surgery was probably going to be the best thing for Roger. If you would like to show everyone your model?
Yes, certainly, certainly. He's sort of somewhat changed a bit. He now looks like that.
So,
which is not taking things too seriously, because I'll kill you if you don't.
So can you tell me a little bit about Arnie?
Arnie? Well, I tell you, when I saw it, Jason showed me in his rooms, I was absolutely horrified. I thought it looked like something was going to burst out of me and run off down a heating duct or something, like an alien, horrible. But so we sort of tarted him up a bit, and my wife did. She's very good knitter, as you can see. My son managed to break his leg this morning, but he's going to take him home and repair him. But that's it. So looking for a job in a coffee shop, if anybody knows him.
You are, or Arnie is?
Arnie is not me. I'm done with that.
All right. So that's how you felt when you first saw
I felt
Arnie.
Very ordinary. Yeah.
Okay. Do you think Arnie helped you to understand a little bit better what was going
certainly. on? I certainly looked at him and I thought, well, that's not stentable. He laughed. He laughed. Had a stent, yeah, right. Not possible.
Well, I guess the benefits of 3D printing is even you as a patient can see that obviously what would have been best for you and what was best for you was open surgery.
Absolutely.
So how did the wife clearly liked it?
Sorry?
The wife clearly liked it.
She did. I mean, we've been together since she was 15.
Oh, that's nice.
She'll be 17 next year. No. No, she's got to reverse the numbers. She's probably been with me since she was 15. We think one another now. We can, communicate almost without speaking. She's in Queensland playing badminton, so I've got to sort of send her some sort of proof of this.
We'll put this on the website so you can show her the
Look, yeah, lovely. This is where my old Lions Club stuff comes in quite handy. Speaking publicly, although somewhat quietly on top. But it was very confronting, but I think when you're lucky enough to find it, then it's not, your name's not on that. That's not going to get you. Unless you're very unlucky and God's got no sense of humour, which I'm sure she has. So if they find it, everybody should get checked. Really good chance with the team that I had. Very good chance that you're going to be okay.
So what did the rest of the family think about Arnie?
Well, they really, my children, big
We've
fella
got
up the
Peter
back
here today.
Pete's up the back, he's 52, he can think what he likes. There he is. He can think what he likes. He broke his leg too, because he's quite strong, isn't it? Snap. It's, my daughter, they've taken in their stride. I think the wife was a bit horrified. I think when I was in hospital, she actually threw him across the office at one stage. because she doesn't like being on her own, as mother said. So it's worked out very well, and I just sort of, it's given me a bit of a different view on life, actually. I sort of, it puts things in perspective. You understand it? People are important, money, very secondary. It's handy, it's handy, but you need stuff, you don't need money, you need stuff. Stuff in the supermarket, stuff anywhere else. It just gives you, puts things into perspective.
Well, I'm very glad that our team was able to help you.
He did. He was very helpful.
He's a good surgeon, isn't he?
Sorry?
He's a good surgeon, isn't he?
Oh, yes, absolutely.
Well, Roger, you've got an entire room full of the brightest scientists and engineers and clinicians here. Is there anything you would like to say to us?
Oh, look, thank you for the team that helped me. There's not many men that have held my hand at 1 o'clock in the morning after the second operation in 3 days, but this gentleman has. They're telling me he won't let me die, which I...
Thank you for that.
Yes,
Thank you
very
much.
Although he only wants the money anyway, so he wouldn't have. No, it's you people are doing seriously good work, and just encourage you to keep it up. You're all here on a Saturday, you're not getting time and a half and double time, I realise. Very important. In awe of your intellect, because I don't have that. We all do our little bit for the world, don't we? All turn it. We're all big or small cogs, and we have to turn, and I'm here turning today.
Do you have any advice for us? What we can do better for patients?
Not really. Look, no, I couldn't. I don't feel qualified to do that. I mean, I had exceptional care. I had a very busy couple of years medically. Knee replacements, golden staph. Gee, I tell you what, if I'd known about that golden staph, I think I would have let you go in. Shocking. Shocking. And the worst thing about the whole thing is the general anaesthetic. I trip out. It's like LSD. Boys in the 60s are like LSD. I was going to leg it down Burgundy Street there at one stage. Woke up and I could see them striking the film set. I'm laying there hallucinating. I thought they're striking a film set. I've got tubes out of everywhere. I thought, I wonder if I can get out before they kill me. Shocking stuff. When I had my knees done, I didn't have general.
Oh, really?
No, spinal thing and local, the sedative, So that's my story. I'm probably rambling a bit, so excuse me.
Rather you talk than me.
Roger, if you don't mind me asking you a question. The audience here hasn't met you before. Would you mind telling them briefly sort of who you are and sort of a little bit about your
it's not
life,
many.
and also because we're a group of mixed engineers and scientists and doctors, how you see all of the technology that you've experienced whilst you've been in and out of hospital, and how you think that might go better.
Yeah, I don't feel qualified to sort of say that, but I mean, I'm an ordinary, not many people can guess what I do or what I've done as a job. I'm a plumber. Most people say anything else, you're a plumber too. I sort of specialise in heating and things like that. I come out from England when I was 23 with Pete, who's a little tacker. Worked hard and and done everything I can. Interesting point, my brother had the same thing 5 years before me, and he had to be opened up.
This is the abdominal aortic aneurysm.
Yep. That's the thing of the family to watch, isn't it?
But all of the machinery and the computers and the equipment that you saw being used around the hospital, was that something that scared you?
No. No, I when I'm in that situation, I resign myself, I give myself over to the people because I have confidence.
And what puts you the most at ease about the whole hospital process and how you go through that?
What puts me at ease about it?
Yes.
I think the professional attitude from the nurses and everybody, professional attitude. I mean, you're talking to a bloke that was always, every nurse knows me as lovely Roger. This is a fact. I'm always a good patient, you know. Do as I'm told, absolutely. Just give yourself over and trust the system. We've got a pretty good system here. I mean, you know, you could be somewhere else, and I mean, even America, something like that, just die. Let you go. In Australia, we don't do that.
So I'm aware that you can't stay all.
No, it's okay.
But would you mind if the audience asked you some questions
No,
about
of course.
your experience?
I'll just speak up because I'm a bit mucky.
Just to clarify, Roger presented with a large abdominal aortic aneurysm and subsequently underwent surgery, and as part of that process we 3D printed a model of his abdominal aortic aneurysm to show him what we were going to do and what the problem was. He had a complicated experience in hospital. Not everything went smoothly, but he's done very well from that surgery since. And he's spoken about how there is a hereditary component to this, his brother, and we've had discussions about his family and his children. But for those of you who don't deal with patients every day, this is a fantastic opportunity for someone to answer questions about what it is that they like or don't like, or think can be improved, or would wish in our health system.
Yep.
Roger, I run a 3D printing lab up in Brisbane. My name's Mick. I have to admit, I have all my little printed models stay in my office afterwards. It looks like you kept yours and personalised it.
Yes.
Does it mean a lot to you, having that?
No. No, he sits on the desk actually in my study and slash office. Sometimes I put him behind the screen so I can't see it. But no, it just doesn't mean a lot to me, but it was a very, very confronting thing when I first saw him. Because I mean, you see it, and when you see, or they say you've got an aneurysm, it's always nice and neat and top. It's not like that. I mean, oh look, really. I mean, that's the most confronting thing about it all, I think.
Yes.
So I'm Stuart Ryan, I'm working at the university. Just interested in how, as a patient, your perception of the aneurysm was different to looking at a CT scan. Because often doctors would show.
A CT scan, I can, you know, it's just, you might as well turn it upside down to me. It means absolutely nothing but that. Do they do that with all of them now?
Working towards it.
No?
Working towards it.
Yeah, yeah.
Only for special people like you.
You don't have to butter me up, Joseph.
Any other questions? Yes, Jen?
I've actually, my dad passed away because he had an abdominal aneurysm, and I'm from the US. He was a Vietnam veteran, so he had government-funded health care, which meant minimal. And so the 3D printed version of his aneurysm wouldn't even have been an option. Is 3D printing in medical care widespread outside of the US? His life might have been able to be saved if they had been able to see what was wrong with him, but
I think it would make you do something, because when you've seen it, you can't flower it up as something that nice, neat thing. You can't. You go, that's got to go. I'm sorry you had that. It's terrible.
I'm just curious if 3D printing is being used in other countries in this sort of case, where in the US, if you wanted a 3D printed scan of your CT, you're going to pay $100,000 just
Yeah.
to get a $5 plastic piece of.
Well, to answer your question, Jen, the answer is no. And I mean, to be honest, the materials, as you know, for a print like that, are probably in the order of around $2 or $3. The time and labour involved is significant, so you would probably be a few $100s worth of segmentation and processing time and printing time, but none of that is hundreds of thousands of dollars. The biggest barrier to doing this is, first of all, that people don't know it's possible. Secondly, people don't have access to the equipment, or they don't know how to operate it. Or lastly, they're not sure that it's valuable.
Can I interject?
Yes.
as well? I'm Nathaniel McCabe from Auckland Hospital in New Zealand. So we're wanting to get into that sector as well, and so a little bit over the world. Pots getting dropped across the pitch, but yeah, we're wanting to get into that sector as well. So.
If there's no more questions, we'll wrap up the session. I'd like to thank Roger so much for
My
your time.
pleasure.